Hi, Paulo. So I'm Miss Young, and I'll be your physician for today. So it seems to me that you've been struggling with using your arm, and there's some weakness in your muscles. And when we did a checkup on you, we noticed that you have some slurred speech, and dysphonia, like you have trouble swallowing. And so my diagnosis for you right now is a disease called myasthenia gravis, or MG. You might not have heard of it before, but it's something very similar in symptoms as ALS, which affects your muscles in a way that's not necessarily just your physical weakness. I understand it might be easy to think that the weakness is actually in your muscles, like maybe your muscles are deteriorating, but that's not really the case. Um, it's an autoimmune disease that attacks neuromuscular cells. And so it blocks the impulse that your neurons are trying to create in order for you to control your muscles. So it's not so much the strength of your muscles, but your ability to control them. Um, and just some background on how it works is that there's a neurotransmitter called acetylcholine that you use to strengthen the precision of how you use muscles. And it's been like that. It's always like that for everyone. It's a very important neurotransmitter. And so this disease in particular just means that the receptors for this neurotransmitter is being blocked. And so it's hard for your brain to process how to use certain muscles. And there's nothing wrong with that. And there's definitely a way that we can fix it. Um, and before we jump to conclusions, though, I would really like to run some tests. We could do an acetylcholine receptor antibody testing, which just means that we're testing for malfunctions in acetylcholine receptors. And usually 85% of patients with this disease will test positive, and so you should be okay after this test. But if you test negative, we want to make sure that we cover all our bases, and there are two other tests that we could do, which is an anti-musk antibody testing or an androphonium test, both of which are harmless, and you don't have to worry about side effects or anything. And so we can go ahead and do that first. Once we confirm that you do have MG, my treatment would be for you to do a symptomatic treatment using acetylcholinesterase inhibitors or inhibition. So, this is an enzyme that breaks down acetylcholine in your body. And since there's not enough reception to acetylcholine right now, we want to make sure that there's enough in your body that your neurons can detect it, and so then your muscles will therefore function better afterwards. And this is definitely a very effective treatment for it. I wouldn't recommend the other treatments that you might have seen before because some of them have long term side effects. The other ones are sort of short acting, and there are surgical treatments, but we don't want to put you in surgery if we don't have to. One thing to keep in mind is that it is a chronic illness and there's no cure for it, so you have to make sure to keep an eye on this for a little while. Um, there is some consensus that it could cause earlier death, but it only catches on to about 4% of patients and is usually associated with additional symptoms linked to this disease, but not necessarily this disease. Just something to keep in mind. And yes, I think now we can proceed to the testing, and I'll make sure to walk you through every step. And if you have questions, please let me know.